Hello and welcome back to another podcast of 1 Minute MRCP by Dr. Raza. Today we'll talk about human immunodeficiency virus HIV. The most common cause is HIV-1 infection, whereas HIV-2 is restricted almost completely to West Africa. A few words about pathophysiology, where HIV attaches to the CD4 receptor on host cells with its GP120 glycoprotein binding site. The viral entry into macrophages occur via CCR5 during the early stages, whereas CXCR4 receptor are responsible for the transmission of virus in later stages. Individuals without CCR5 receptor appear to be resistant to HIV. Glycoprotein 120 is the HIV glycoprotein that can cross placenta and infect the fetus. The sexual route is the most common route, responsible for around 80% of infections worldwide. That is followed by parental transmission, needle sharing, and vertical transmission from mother to child during childbirth. Acute retroviral syndrome, or an acute HIV infection, usually occurs 2 to 12 weeks after infection. It's characterized by fever, fatigue, myalgia, and arthralgia. Moreover, non-tender lymphadenopathy and rash can occur. Clinical latency and AIDS can be asymptomatic. There are a few conditions that are associated with HIV but are non-AIDS defining conditions, like generalized lymphadenopathy, chronic diarrhea of more than 1 month, oral candidiasis, oral hairy leukoplakia, HIV, HPV-related squamous cell carcinoma of the anus, molluscum contagiosum, warts, and shingles. Kaposi sarcoma with a CD4 count of less than 500, tuberculosis, progressive multifocal leukoencephalopathy, disseminated or extrapulmonary coccidioidomycosis, pneumocystis pneumonia, disseminated or extrapulmonary histoplasmosis are the AIDS defining conditions. When the CD4 count is less than 100, so we should suspect diseases like cerebral toxoplasmosis, extrapulmonary cryptococcosis, esophageal candidiasis or pulmonary candidiasis, herpes simplex esophagitis, and primary CNS lymphoma. Whereas MAC and CMV infections are common if the CD4 count is less than 50. The World Health Organization has classified HIV into primary HIV infection and the 4 clinical stages of HIV infection. The diagnosis is based on ELISA testing for HIV-1-2 antigen antibody combination immunoassay. Target of detection is IgM and IgG antibody and P24 antigen. HIV viral load test is done with the help of PCR, and the approximate time to positivity is around 5 to 15 days.